Hi guys, this video is about proptosis. So, what is proptosis? It is the forward displacement of the eyeball beyond the orbital margin. So, it is the forward displacement of eyeball beyond the orbital margin. If it is in Graves' disease, we will say exophthalmos. Now, coming to the clinical classification of what proptosis. So, proptosis can be classified as unilateral proptosis and bilateral proptosis. Unilateral proptosis, the etiologies are inflammatory, tumors, vascular, cyst and mucosal. So remember it by INTU or CM. INTU or CM, IN is inflammatory, which is the main inflammation, orbital cellulitis. So it is the most common inflammation in the children to cause proptosis. So orbital cellulitis. There can be other orbital abscesses and then panophthalmitis also can cause proptosis. So the inflammatory conditions are orbital cellulitis, abscesses and panophthalmitis. Now coming to the 2. What is 2? Tumors. Tumors are rhabdomyosarcoma found most commonly in children. If it is in adults, we can see cavernous hemangioma, then lacrimal gland tumors and optic nerve glioma. So rhabdomyosarcoma, cavernous hemangioma, lacrimal sac tumors and optic nerve glioma. Now, what are the vascular causes? Orbital hemorrhage, aneurysm, cavernous sinus fistula and also orbital varix. So, these are the vascular ones. Now CM, C for cyst and M for mucosals. So cysts are the dermoid cyst and hydatid cysts and mostly the mucosals of frontal and ethmoidal sinus causes unilateral proptosis. Now coming to bilateral proptosis, remember it by INTU ENS. So INTU was CM, now INTU ENS. What is INTU? Why? Again, inflammatory and tumors. What are the inflammatory condition? Here it is cavernous sinus thrombosis. So here the inflammatory condition was orbital cellulitis, abscess and panophthalmitis, or the complication of the orbital cellulitis, that is the cavernous sinus thrombosis, and also Mikulicz syndrome can cause what? Bilateral proptosis. And 2 is tumor. Here the tumor to cause bilateral proptosis is what tumors? Lymphoma, leukemia and also metastasis, that is neuroblastoma in children. Here it was rhabdomyosarcoma, cavernous hemangioma, lacrimal gland tumors and optic nerve glioma, while here it is lymphoma, leukemia and metastasis of neuroblastoma. Now ENS, first one EN, that is the endocrine, that is the most common cause of bilateral proptosis, and that is thyroid eye disease, that is our Graves' disease. And D and S, D for developmental, that is craniofacial dysostosis, mainly oxycephaly or osteitis deformans can cause bilateral proptosis, and S is the systemic cause, that is histiocytosis, Wegener's granulomatosis and amyloidosis can also cause bilateral proptosis. So just remember for the cause, this is very important question, into a CM and into N. Inflammatory, tumor, endocrine, development and systemic. And there are mainly 2 types of proptosis, axial proptosis and eccentric proptosis. So axial proptosis is due to the intracorneal mass. This intracorneal mass will get proptosis, while in the eccentric proptosis means it is the extracorneal mass. So it is outside the extraocular muscles. This mass is getting proptosis. Now specific clinical types, acute, intermittent and pulsatile. Acute means it mainly occurs in orbital emphysema due to the fracture of the orbital walls like medial wall. There can be acute proptosis, and also in orbital hemorrhages there can be acute proptosis. So orbital emphysema, hemorrhages, mainly trauma and hemorrhage. Now coming to intermittent one, it is seen intermittently only, that is during bending, during cuffing, during Valsalva maneuver, and these are known as orbital varix. So orbital varix is an example of intermittent proptosis, and pulsatile proptosis are due to vascular causes of proptosis like carotid cavernous fistula, roof defects and all. Now the clinical evaluation of proptosis. So first do the inspection. So inspection is to look for whether it is an axial proptosis, that is the intracorneal mass, or eccentric proptosis, that is the extracorneal mass. Next, palpation. Look for the compressibility. If it is compressible, it can be vascular cause, or if it is not compressible, it is a solid tumor. And also look for retropulsion. Now do the measurement. So the measurement is done using Hertz exophthalmometer, and it is measured from the lateral orbital rim to the corneal apex. So lateral orbital rim to the corneal apex by exophthalmometer. Normally it should be 10 to 21 millimeter. If there is more than 2 millimeter difference between both eyes, that is significant. Okay, 2 millimeter is significant. Now differential diagnosis of pseudoproptosis is ophthalmos. eye is big, so it will look like a proptosis. High axial myopia, again that is an enlarged eyeball. Then lid retraction, so the lid is retracted, so we think it is proptosis. Now contralateral anaphthalomosis, so if the opposite eye is small and this eye will be having a proptosis like feature. So these are the differential diagnosis. Now investigations are imaging. So if it is an orbital cellulitis, we can find it by CT. If it is any tumor, we can find it by MRI soft tissue. Also do a USG scan to look for any optic nerve involvement or not. And then laboratory tests like thyroid profile to rule out exophthalmos or the Graves' disease. So this was about proptosis. This is a very important topic. I think this was useful for you. So thank you.